Yeah, so I actually started at a private school north of Pittsburgh, Grove City College, and I ended up changing my major my junior year, and it was going to take me longer, and I didn't want to take out, more loans, so I moved back home and transferred to University of Louisville to get my degree in chemistry there. But it was, it was just nice to come back home to a place that was familiar, and U of L was just a really good fit to continue my education and finish out my bachelor's.
That's great. So as I said, you earned all three of your degrees from U of L, and we love that. So what was it beyond choosing, U of L and transferring as a student to come for your undergrad? What was it about the program or the school or the city that kept you coming back for each of those subsequent degrees?
The master's degree, actually, it was, the School of Public Health was relatively new. I got a flyer in the mail, and I'd been thinking about getting a master's degree. I was working at Humana at the time. Everyone had their MBAs, but I wanted something that differentiated myself. And so when I got that, it was just like a natural fit with healthcare, but it differentiated from business and doing something around population health. So I was just so intrigued. Applied, was accepted, and I wasn't planning on going further than my master's, but I just loved the classes. I loved the faculty, and I was like, I just want to keep going. So, I mean, it's not that I wanted people to call me doctor, I just didn't want to stop learning. So that's how I ended up with a PhD.
That's probably the best reason I've heard to get a PhD. I love that. You just want to keep learning. You love the community at U of L. So as you think about your time at U of L, the degrees you've earned here, what is it about your education, the School of Public Health? I imagine there was probably some transformation happening as you went through the kind of the process of getting each of these degrees, as you thought about, what you wanted to do with them and the kind of career you wanted to have. So what was it about your time specifically with the School of Public Health? It sounds like you really love the school there. And what was it about that inspired you to do what you're doing now?
Well, it's so different from undergrad to graduate school, just your interactions with the teachers. Your classes are smaller, your teachers are more invested in you. You make personal connections with your professors, and there's, especially if you come into your master's already having some of your career behind you, so you have a perspective when you're learning things. So, when I was there, I already kind of knew the path I wanted to take in my career, and it really helped me focus my studies in a specific way. Because public health is so broad, there's so much you can do, but I knew that I wanted to focus it towards managed care and especially pharmacy, where I'm at now. So I was really able to have those discussions with my professors that helped them to grow me to be where I am now.
Are there, so I think you mentioned your professors, the faculty, everybody's been, if they're honest, helped along the way by people like, key faculty or mentors. Is there anybody within the school, college, or anybody like that in your time at U of L that was kind of key and instrumental, and how did they impact your development professionally?
Yeah, I think that, everyone in the policy department, especially my advisor, Dr. Wayne Scott, on my dissertation, they were just very big proponents of you and being a success. They just really champion you, and they want to see you succeed. So they're going to help you in any way that they can. And I just really appreciated that. And there was really a time crunch because Dr. Wayne Scott wanted to retire, but he kind of stuck around just a little bit longer so I could finish my dissertation. And I really appreciated, him hanging through with me.
That's awesome. Committed faculty. I love that. So let's talk about your career a little bit. Maybe you could fill us in on your career path to where you are today, and kind of what you're what you're doing now, and what kind of work are you involved in, and what kind of impact does it have?
Sure. So I leveraged my chemistry degree from U of L to work in a lab, and that's where I kind of started out, was testing raw materials. And then I moved into the pharmacy world, working for Kindred Pharmacy Services, which is downtown before they got bought. And I worked there for a while, and then I moved over to Humana, and I was there for almost 10 years. And when I was there, like I mentioned, I did my master's and my PhD. I was able to use Humana data for my dissertation, which was amazing. I had multiple kind of jobs while I was there, so I was able to learn a lot. I started in procurement, buying drugs for their mail order pharmacy, moved into finance, did an analytics position, helped start the specialty pharmacy, and then finally I did what was called value-based contracting. So it's trying to move from volume to value in the way that we buy drugs, and making pharmaceutical manufacturers responsible for the outcomes and whether they achieve the outcomes that they're supposed to when members take those drugs, and making those drugs affordable to patients and also, accessible so that the patient gets the right drug at the right time. So I did that for the last 2 years at Humana, and then I moved on to OptumRx, which is owned by United Health Group. If you have United Healthcare, then OptumRx is your pharmacy benefit manager. And what I do is basically the same thing now that I did at Humana, but on a bigger scale. I do value-based contracting, so I work really closely with pharma, and I also, in this position, I'm very fortunate. I can also have input into policy. United Health Group being such a big player in the healthcare space, they work closely with people in Washington, so I've had the opportunity to interact with HHS and CMS in terms of policy around healthcare. So it's really exciting, and it's leveraging what I learned in my master's and my PhD, because that was around policy and how policy affects healthcare.
So it's probably not news to you that pharmacy and healthcare can be kind of overwhelming for people to understand the background and all the work you're doing to kind of help, with what I think you call value-based prescriptions. And so help break it down for people, and how does your role maybe impact those who are a part of your program and the people that are under your benefits?
So I think that what people might be most familiar with, because it's been in the news a lot lately, is gene therapies. And in fact, I saw Norton Healthcare just had on Facebook, they talked about Zolgensma, which is the therapy for spinal muscular atrophy, and that's in babies, and it's $2.125 million. It's just a one-time administration, and it's a cure. It's not really cure, but it does slow the progress, and hopefully for a long time. But so gene therapies are on the horizon, and we have a lot coming. We have some for hemophilia. They're all for rare disease. They're all going to be in the millions of dollars. And so there's this potential to all of a sudden have an influx of billions of dollars worth of therapies that people are trying to have access to. But we want to make sure that those drugs work and that they do what they're designed to do. So if it fails, if this Zolgensma fails in a patient and we've paid $2.125 million for it, we want the pharmaceutical manufacturer to refund us back all that money because your drug didn't work. So that's what value-based contracting is. It's we'll pay you when the drug works, but if it doesn't, we want some money back.
It's kind of holding them accountable to that their drug does what they say that it does.
Yep, exactly.
That's great. So let's talk about your community involvement. So it seems like you're very involved in giving back to your community, to the Louisville area. And so I'm looking at what I have in front of me is that you're involved with Fed, or have been in the past, through Fed with Faith, the YMCA, DuPont Manual. Tell us a little bit about your giving back to the community. If you want to mention anything particular about those groups that stands out, and why you're so involved in those things and in the local community.
Yeah, I mean, it's hard when you're busy and you have kids to get in, to give back to the community. And so I'm always looking for ways that are easy to fit into your schedule, but still give back. So Fed with Faith is a great organization. On Sundays, you can sign up for time slots, and you go, and basically they put you to work. You might be making peanut butter sandwiches and packing them in bags. You could be, scooping meals that they're going to go out and deliver to the homeless that night. But you can sign up for as many shifts as you want. You can work all day. You can come work for 2 hours. And so it's really a great opportunity. And we go and do it as a family whenever we can. And it's really a great way to give back, but it's a good bonding experience with the people that you go with, because it's fun, but then you're also doing something great. And that's the best way to, to volunteer and do service. And then I also am currently on the board for the manual PTSA, and that's because my daughter goes there. So I kind of got suckered into that, but it's also a good way to give back as well and to benefit, all the kids that are there learning.
That's great. I mean, we need parents involved in the education system. So that's good. So now I'd like to just kind of take a more reflective angle and take a big picture angle of your career and kind of your life thus far. So kind of looking back over your career so far, what advice would you give that younger version of yourself? You could pick any one of the 3 degrees you got and whatever seems like the most pivotal time, but go back to your younger self with everything you've learned now, the wisdom you've learned from your family and your job and career. What advice would you give that younger version of yourself as you were first setting out?
I think the best advice that young people, and I give this to people all the time when I meet them, and when I'm mentoring or anything, it's network. Like it's never too early to network, even in your undergrad. When you meet people, you need to have a LinkedIn page and you need to connect with all those people that you meet, because you never know. It's such a small world, and you're going to come in contact with all these people again, and just network with them and find out about them and learn something personal about them and just make a connection. And I think it'll really serve you well through your career if you do that, because a lot of times it is who you know and who you've made a good impression on that's going to help you move up. And then my second piece of advice would be find a mentor, any kind of mentor, that somebody you respect and someone that's doing what you want to do, and just ask them to mentor you and to help you and what advice they would give you, because everyone I think that moves up, they want to help the people behind them. And I know that's me. I love mentoring people. So those are the 2 things I would do: network and mentor.
That's good. You hit my next follow-up was going to be, what advice would you give other students or young alumni? So that works perfectly. Let's see what, sorry, looking at my notes here. So what about your current career and job motivates you to get up and go to work every day? We've talked about it kind of from different angles, but you seem really excited about your work, passionate about what you're doing. And so I'm just wondering, what is it about your day-to-day, week-to-week that gets you up and motivates you in your career?
In my current job, it's very, how should I say this? So my current job is very broad. It's not defined and, a straight path, and this is what I'm going to do today. There's a lot of room for innovation. So that makes me excited, because you really have an opportunity to color outside the lines and think outside the box and just get wild in the concepts that you're coming up with. So every day is different. I'm having conversations with all kinds of different manufacturers and just coming up with different ideas. And, out of 10 conversations, maybe one's going to work, but still that one, might be the game changer, the thing that changes the industry and makes a shift in healthcare for people. And I'm really passionate about, people getting their medications and having access to them and making them affordable. And so I hope that something that I'm doing is in some way contributing to that and contributing to the change that hopefully we see by the time our kids are buying insurance for themselves or sooner.
I just kind of want to talk now. We're near the end here in terms of my questions, but how are you staying connected to U of L? What do you, how do you feel towards the institution now? If you were to kind of fill in the blank, you know, I feel connected to U of L because, or I love U of L because, how would you fill in the blank on that kind of statement or question?
I still feel very connected to U of L, just being an alumni. I mean, I follow on LinkedIn when U of L posts, I comment. Yesterday on Facebook, U of L Brandeis School of Law was having a panel discussion about Breonna Taylor, and I stopped and watched. I thought it was so engaging, and I think that U of L is making great strides to really embed itself in the community, and I think that's so important. And I think there's a lot left that can be done. I really want U of L to have more of a national presence for things that aren't just athletics, although I love U of L athletics. But I mean, I would love to see them doing, you know, I mean, Talorus started here. I'm very passionate about kidney transplant because I donated a kidney to my dad last year. So it started here that they have a trial where the donor can, it has something to do, I think, with stem cells, but they harvest them before you donate and put them into the recipient, and then that recipient can wean off of their immunosuppressant meds. And immunosuppressant meds are awful. They can cause cancer, they can cause rejection of the kidney. That's amazing. That's huge work. And like, everyone should know that it happened here in Louisville, you know, and that was the U of L thing. So just stuff like that, which I'm so passionate about broadcasting things that happen here that I would love for just everyone to know, because I think that there's some groundbreaking things that happen at the university.
So that's really it for my questions, but I just want to pause at the end here and say, you know, is there anything you came into this wanting to say or to communicate that we didn't talk about or to share with anybody in the U of L community that you want them to hear from you?
I think I would just say that my experience at U of L was amazing. I hope that U of L continues to sell itself and continues to grow and bring people in. I think that we're kind of looked down upon sometimes, you know, compared to UK or some of the other, you know, universities. But I mean, I loved U of L. I think that U of L has so much promise, and I think it's producing some really smart and influential people. So I think it's a great place to be.